just to let you know that the aim of the session is going to be an open and honest community discussion around the issues and concerns about the vaccine and the rolling out of the vaccine. So we have an illustrious lineup of speakers, of which I'll begin to introduce you to them. We have one of our first speakers, Leslie Watts, Chief Executive of Northwest London Integrative Care System. Following Leslie is Professor Julian Redhead, Medical Director for Northwest London and Imperial College Healthcare NHS. And following Julian will be Dr. Yasmin Razak, Clinical Director, GP from Neo Health Primary Care Network. Following Dr. Razak is Dr. Anna Blakeney, who's joining us from Canada. Welcome, Dr. Blakeney. She's worked on the vaccines while at Imperial College. And following Dr. Blakeney is Pippa Nightingale, Chief Nurse of Chelsea and Westminster Hospital and Lead Director on Community Vaccine Programme for Northwest London. And last but definitely not least, Nafsika Thalasis, Director of the BME Health Forum. So we've got more to say, and this is really about the event and how it will be run. So we have a series of questions, and I will hand over to Leslie to kick us off. Thank you. Over to you, Leslie.
So evening, everyone, and a really warm welcome to these sessions. It's lovely to see so many of you here. We want to work with you, our NHS, our local authorities, all of our communities actually are working so well together at the moment. And that's why this is such a joy to be able to talk to you, to hear from you, to learn from you actually. We'll be having more of these sessions, and it's a real big thank you and shout out to Healthwatch Central West London for hosting this session. But to say, I know what you really want to hear and who you want to hear from our clinicians. So I'm going to say, let's get on with it. And thank you, Julian.
Leslie, thank you very, very much. And this is our second event that we've had together. And I'm hoping that we've got people who've come back for the second time. And I think it was really helpful last time. And we learned a lot. So one of the things we learned immediately was that you wanted us to use Zoom rather than Teams. So here we are on Zoom, which is a little bit different for me. So forgive me if I'm not quite on the ball with some of the technology going on here. But that's what we've done as well. And obviously, when we talked last time, we talked very generally about things, but what became very clear was that you want to have a real in-depth talk about vaccinations. And that's what tonight is going to be about, is to really concentrating on vaccinations. You can put other questions in the chat and we'll try and get to those if we've got time, but also we'll use them as feedback for the next session and understand where you want to go. And we really are very, very interested in your feedback, because the plan will be to repeat this event again and again and have this as a regular part of how we interact and how we learn from each other and work together to improve the healthcare for everyone. I think it was really good of you guys to identify the vaccine as one of the most important topics, because it really is important that we really try and make sure that everyone can make the right informed decision. So having the right information for all of you and for all of our communities is really important, so they can then make an informed decision on how they want to use the vaccine. Now, clearly as a doctor, I'm going to say, please, please, please have the vaccine. And I hope that some of the information you'll hear today will lead you to that conclusion as well. But the most important thing is to be able to give you that information so that then you can make your own informed decisions. So I think what we're going to do now is just to hand back to Sharon, and we're going to go through some of the logistics and then on to the questions.
Thank you, Dr. Redhead and Julian. Thank you so much. Yes, so the logistics of the meeting will be as this. As mentioned earlier, the meeting will be recorded. This is just to ensure that we capture all of the conversation that's taking place, and only speakers and panelists will have their video and sound on. So this will help you hear and see the speakers better. We will be gathering questions in the chat box. And so any question that is absolutely important to you, please feel free to ask. We can manage the chat and your question that will remain anonymous which is a public chat, to be honest with you, so that it will remain anonymous, but you'll only be able to see your questions in the chat box. So I can see all the questions. We're working with Layla, who's behind the scenes, who will ensure that the important questions are answered. And by the way, there is a range of questions that will be really helpful to know. We will have 3 pop-up polls, by the way, throughout the event. And we will have, yes, these pop-up polls, which we're going to start one now, actually. So in these pop-up polls, there are 3 questions, and we'll start with the first one to make this interactive with everybody. So we'll now have the first poll, and can you please complete this question? And the question is, how likely are you to have the vaccine? So just bear with me while I get the poll. Bear with me. Thank you. Thank you so much. I'm going to end this poll. And the results are, number 1, highly likely, 10%. 1% who have said that it's at number 2. And also, I think the highest in this figure really is highly likely to take the COVID vaccine, which is great. We will ask another similar sort of question at the very end of this session, near the end. Thank you so much. And another thing I need to make you aware of is that the pre-event questions will be answered as much as possible, of which there are quite a bit that's been submitted. Wish to say thank you so much for that. So I'm going to hand over to Dr. Yasmin Razak. Thank you, Dr. Razak.
Hello. Lovely to meet you all. My name is Yasmin. I'm a GP in NeoHealth PCN. My role is clinical director, and the clinical directors in North West London are taking the lead on the vaccine rollout in their groups of GP surgeries, and that's a population of between 30 and 50,000. Our main remit is to make sure that we have population reach of the vaccine and answer all our questions for our patients. And run the hubs and staff the hubs with our teams and working with our community, and make sure that you have the vaccine as near as possible and as accessible as possible. So welcome everyone today. It's really I'm very grateful for the opportunity to talk about the vaccine rollout. It's been a magnificent development in primary care and in the country, and as a nation we are doing remarkably well, and I would say just a big thank you to all of the teams supporting and contributing from across the voluntary sector, primary care, secondary care, in the community, in the council. It really is a massive collaborative effort. So I have a question that was posed to me, and it's a good question. So starting as a GP, what would I say to someone who is hesitant of having the vaccine? And I think that's a really important question, and that's probably a question where I'm trying to answer a lot. So I think one of the things to think about is our immune systems are all different, aren't they? And that's probably one of our worries and one of our fears. And that's just, you know, a fact of life. We're all responding quite differently in this environment, and we respond differently to the virus itself. So it may be that I may have had a very mild set of symptoms when I had my COVID. First round of COVID came in March, didn't it? So that's when, you know, a lot of us had it then, didn't we? And you know, it didn't really affect us. It was absolutely fine. But of course, there's a real reality and real risk that we could be contracting it and spreading it to another person, and that other person could be terribly unwell in a hospital setting, potentially losing their life. And it's something to do with how I feel. I've had my vaccine. I've had my vaccine, and it's something to do, I think, with civic responsibility, our civic duty, to make sure we're not just protecting ourselves, even if we know our immune systems might be able to bear the brunt of this horrible illness, but also protecting others, the vulnerable, our friends and family. And we don't know who this virus is going to hit worse, do we? We've seen it every time. We've all had examples of friends and relatives who've just been hit really badly and unexpectedly. And I would also say, if you're in a hospital and you're offered a life-saving treatment, or you have a serious illness, and in fact you're not offered a life-saving treatment, you're denied that life-saving treatment, and that life-saving treatment was 1 and 2 injections, and it was available, and you were denied it. It wouldn't be very nice. Wouldn't be very fair, would it? So I would almost put that as an analogy to where we are now. So could it be by not having the vaccine that you're denying yourself by a couple of injections, a life-saving treatment? It's a preventable illness. We've now got the prevention. It's taken a year to get this far. So many teams internationally working really hard, but we don't want to be preventing ourselves a life-saving treatment. We will feel very unhappy if that ever happened to us in a hospital. If we didn't get to ITU, for example, with COVID, and they've prevented us getting there, we wouldn't be good. But actually preventing ourselves from getting there really is taking the vaccine. And I would also say, as a GP, I call my patients to encourage them to have the vaccine, and many of my patients are taking up the offer straight away. In fact, we text them, they automatically reply, and that's fantastic. There are some people who are really not wanting to have the vaccine, not answering their phone calls. We're trying. We've been calling a couple of patients who we can no longer get through to, and that's really distressing, because it may be the virus has already got to them. And seeing what's happening in our communities, this is a preventable illness. So I would say, when the call comes, when it's your opportunity, and you get that phone call from your doctor, from your surgery, you get the text message, please do book the first available appointment.
Thank you, Dr. Razak. Just wanted to quickly ask you a question. As a GP, how would you try to convince patients who are scared and unsure to take the vaccination?
Yes, and I guess that goes back to what I've just said. And there is fear, isn't there? We have a lot of fear of the system in general at the moment, because we're not sure what's around the corner. Every day is different to the next, and we don't know what life's going to bring. And I think we don't want to create more fear, because creating more fear isn't healthy either. And of course, the real reality, there's a risk of death, and that's scary too. And we don't want to always talk about that. But I would say we should look at the safety profile of the vaccines. And we know that they have been rolled out quickly. But we do know that they have every single check has been made along the way. It's just that the red tape has been lifted and teams are working harder and faster. And so the safety profile of the vaccines is probably higher than others in terms of its what we know about it, and a number of people internationally working on this. And the scrutiny is there, as we all know, which they can't avoid for obvious reasons. So I think the safety is the key. There's new technology. People always worry about new technology, but it's fantastic technology. Again, it's just modern technology. There are no risks or side effects that we would worry about, apart from the obvious achy arm, a bit of a fever. You probably will feel tired for a couple of days, but I mean that's a sign of the vaccine working, which is a good thing. So I would say it's safe and effective. It's easy. It's actually quite painless, and that's what I would say.
Thank you so much, Dr. Razak. That's wonderful. Thank you so much. I'm just wondering, would you like to hand over to Pippa? So Pippa, can you provide us with an update? This is Pippa Nightingale, Director on the vaccine role out in the area. Over to you, Pippa.
Thank you, and good evening, everybody. So I have to say, it's a real privilege to be leading this programme, and it's really lovely as a clinician, after the year that we've been through, to be doing something really positive to try and put an end to this virus and really try and put people's life back to normal. So it's a real pleasure to lead this. So in Northwest London, we've got a big ask. We've got 3.4 million people to vaccinate, and clearly they require 2 vaccinations. So we've got 6.8 vaccines to give in total to complete the programme, or 75% of the population vaccinated, which is the number that we're aiming for. That's a really important number, because actually we need that amount of people vaccinated so we can really get what we call herd immunity. So we stop this virus spreading. The ask really to put an end to this virus. So I was delighted to have my vaccine. I felt so relieved when I had it. I had it just before Christmas, and it felt a real privilege. Actually, I felt really lucky to have it. I did have a bit of a sore arm, I have to say. It ached slightly, but with a bit of paracetamol, there was nothing more to say about that. It has also been just lovely vaccinating people in the vaccination centres and in the hospital centres. The relief on people's faces when they've had that vaccine is lovely, and I can't tell you how grateful people are that have had the vaccine. In terms of how we're doing in Northwest London, so we've vaccinated 184,000 people as of last night in Northwest London, which is fantastic. We're actually ahead of our plan where we were supposed to be, which is really good news. We have 23 GP hubs established in Northwest London. They've been running for some time now, and our GPs are working extremely hard to try and get this vaccine to as many people as they can, as quickly and as safely as they can. We've done a lot of work to make sure these vaccination hubs are safe for people to come to. And I know there's a lot of fear of people coming out of the house that have isolated appropriately for many months and shielded. So we spent a lot of time making sure there's safe places for people to come. So everybody who is working in the vaccination centres are vaccinated themselves. They are all tested for COVID, so they do lateral flow testing, so to make sure none of our staff have COVID, and they all wear PPE, so they all wear the appropriate protective equipment, so we can make sure it's safe. What we've also done is made sure that we can socially distance within that space. That does mean to say people have to queue sometimes because we can't let everybody into a crowded waiting room, so I do apologise for that. But that's just for everybody's safety. So a lot of work has been done. We've also been into care homes. So we've done really well in care homes. We've vaccinated 83% of our residents in care homes, which is great news because we know how badly the care homes were affected in wave 1 of COVID. So they were our priority. They were a national priority. And when we've gone in there, we've also offered the vaccine to staff as well. So we've pretty much completed that. And we're now doing the same in people that are housebound. So people in their own homes that for clinical reasons, they cannot come out. And we're just almost completed that programme as well. And actually, I'm pleased to say that by the end of the week, we will have vaccinated 82% of over 80-year-olds. So again, ahead of the plan. We've done an awful lot of work in the last 2 days around prioritising over 80-year-olds. And many of them that have been hesitant to come when we got to the bottom of it, they were scared to come out of the house. So we have gone to their homes and vaccinated some of the people that were hesitant to come out of their homes, which has really boosted our numbers of over 80-year-olds that have been vaccinated in North West London, which is fantastic. So there's an overview of where we are in North West London. Like I say, we've had a good start and we've got a long way to go. And I absolutely ask for all your support as community members to encourage people to come forward and be vaccinated and come forward yourselves to be vaccinated as well. So as a community, we can really put a stop to this virus.
Thank you so much, Pippa. Can I just quickly ask you 2 questions separately, but you probably answer jointly? I'll leave that up to you. How are you going to support people with mobility issues to get to the vaccination centres? And the other question is, it's why is North West London at the bottom of the league table for the over 80s vaccinations? You've just provided a really good update, actually, so you've pretty much answered that question. That's positive. But it says I'm encouraged to see that that's lifted in a couple of places a previous week, but we're still in a kind of are we still in a relegation zone?
No, we're not, I'm pleased to say. So these league tables change daily because we are vaccinating around 15,000 people per day in North West London at the moment. So they change daily, but no, we're nowhere near the bottom of the league table for the over 80-year-olds. In fact, we're almost ahead of plan right now. And we're very much committed to get to as many of them people as we possibly can. This week is our priority. In terms of how do we support people, so we've engaged with many third-party charities actually that have been absolutely amazing at bringing people into the vaccination centres. So we've got a volunteer transport charity in each of the boroughs that the local authorities have commissioned. So there is free transport for people that need it, and their GPs have got all the details. So when you're contacted by your GP to come forward and be vaccinated, you need to say if you can't get there, and they will offer you the transport from the volunteers that are offering that.
Thank you so much, Pippa. That's quite informative. Thank you so much for providing us with an update. I don't know if you need to do anything more about update on numbers, sites, processes of patients, notified data. Are you happy to do that? Or you pretty much covered, would you say?
Yeah, no, I mean, I think we're covered there. So we've got 23 GP sites and we will also have 10 mass vaccination sites in North West London. So the second one in London that went live on Monday was in North West London. So that was in Brent. So that's Network House at Wembley. Very, very smooth. That has worked like clockwork, and the public have been great at coming forward to be vaccinated. Actually, there's lots of volunteers on that site to support people. It's a really easy site to access, so it's very easy to get booked in there. So if anyone wants to use that vaccination site to be vaccinated, that's absolutely fine. They can do that.
Thank you ever so much, Pippa. That's really informative. Thank you very much. So we're just about to undertake to do poll number 2. And this is a question, and where would you prefer to have the vaccine? Bearing in mind what Pippa has said and provided such good update, where would you like to have the vaccine? Let me get the poll up. There is. The feedback is, and I'll end the poll, my apologies. The feedback is very similar to the results that was held, the respondents at the event at recently at the Al Manar event last Sunday. So that's quite interesting. And I'll share the results for you. So this is interesting. So most people, 82% would prefer to have the vaccine at the your GP practice. Thank you so much. So we have, we're going to enter a question and answer panel, question and answer session. So we'll kick off with, if you're ready, Julian, these are the pre-event questions that's been submitted. So over to you, Julian. I'll ask one or two questions from the pre-event questions.
Go for it. I'm ready.
So thank you, Julian. How many vaccines are we using in the UK?
So thank you. There are currently 3 vaccines that are approved in the UK. We're mainly using 2 though. The first one is the Pfizer one. That was the first one to be approved. And then it was the Oxford AstraZeneca vaccine. Now they are slightly different in how they're manufactured, and they just sort of cover that now, I suppose, because I know that some people will be interested. So the Pfizer vaccine is what we call an RNA vaccine. Now that often has scared a lot of people because they think that's all to do with genetics and genomics, and they'll interfere with their DNA. And the reality is it doesn't go to where the DNA is stored in the cell, in the nucleus. It actually goes to what I would describe as the kitchen of a cell. And that's in what we call a ribosome. And when it goes into the ribosome, it acts like a recipe book. And what it does is to tell the kitchen to produce a certain protein. And the moment it produces the protein, it then disappears and it gets destroyed by the cell. But the protein emerges, and it's the protein that then generates the immune response. So that's based on certain parts of the protein of the virus. So it doesn't interfere with the DNA. It doesn't replicate or stay in the body or anything else like that. So it's just a very good way of getting the body to generate a protein. The Oxford AstraZeneca vaccine is a more traditional one, where you take parts of the virus, break it into little parts, and use some parts of it, so not the whole virus. It's not really the virus that's going into you. And those proteins go directly into the body, and then they generate the immune response. So those are the 2 different types of virus. We've got 3. The third one is the Moderna and there's a number in supply as well. So there's other ones. There's the Sputnik one from Russia, which isn't approved in this country. And there's Novatech one. So there's various other ones which will come online.
Thank you, Julian. That's wonderful. Can I just quickly ask you another question? My wife and I have had our first dose of Pfizer vaccination. We are concerned that the second dose could be in up to 12 weeks. So like a lot of others, we are concerned with what the effect it could have on our overall efficiency of this vaccination. So in light of this, and also hearing different times from 21 days to 6 weeks, a lot of older people are getting confused and worried. How can you assure them?
No, thank you. And this is a really important question. And first of all, congratulations for getting the vaccine. Really, really important. So well done. The next part is, I mean, for me, this came up actually with my mother-in-law as well, because my father-in-law, went to get the vaccine. And he always told me, he said, but I was told it had to be done in 3 weeks later, and this was really important. I was given a date for it, and now I'm being told that it's going to be 12 weeks, and what is happening here? So the reality is that science evolves, and we learn more and more about different vaccines as times go by, and as we analyse the data that was available from the original studies whereby the vaccine was actually produced on. So the most important bit to this probably is to start off that if we were to vaccinate the first 4 priority groups, so those are over 70s, frontline healthcare workers, patients with serious conditions, then that would it would take away 88% of the deaths from COVID would be prevented. So that's a really important statistic, okay? So what we're doing by trying to vaccinate everyone with a first dose is to get to that 88% of lives saved. It's also important to remember that all vaccines really behave in the same way. There's no reason to believe that different vaccines will behave in different ways. And when we looked, started with the Pfizer vaccine, originally it was thought that the first dose only gave a limited amount of protection. But the reality is when you looked at that data in a little bit more detail, it actually gave up to 92% vaccination efficiency. So it prevented 92% of infections in that first dose. And the second dose is more about how long that protection occurs for. So the experts really came up with the idea that 12 weeks would be a reasonable period between the two doses, whereby your protection would be around 92% for that period, and the second booster would continue your protection on from there for another year. With the Oxford vaccine, there's actually good evidence from the studies with Oxford that delaying that second dose for 12 weeks actually give you a bigger immune response. So there's good evidence coming out from that as well. So really it's to do with evolving evidence, and the evidence at the moment would suggest that 12 weeks is the time to have your second vaccine, or somewhere around that time, to give you the best long-term protection, but given a good rate of first protection for as many people as possible through that first four cohorts.
Thank you, Dr. Julian. That was wonderful. Thank you so much. I wonder if I could turn your attention to Anna. Dr. Anna Blakeney. Just got a couple of questions for you. If you can unmute. Thank you, Julian. You're there. Wonderful. Anna, the first question is, in plain English, what is in the injection? And where did all the ingredients come from?
Yes, so this is a great question. And so as Julian pointed out, there's kind of two different classes of vaccines that we have approved at the minute. So RNA vaccines and the Oxford and AstraZeneca vaccine, which is what we call a viral vector. So for the RNA vaccines, what I think is one of the coolest things about them is that they have very defined ingredients. So they're made what we describe as completely synthetically in the lab. So we basically put the ingredients into a test tube. We use what's called microfluidics to combine them into small particles. And we know exactly what the ingredients are. So for RNA vaccines, there's 5 ingredients. They're RNA and then 4 different types of lipids or fats. So it's basically just RNA encapsulated in this blob of fat. So those are the ingredients for RNA vaccines. Where do all the ingredients come from? We buy them as very pure raw materials directly from basically chemical sources, and then combine them all in, again, what's called a GMP facility, which is just good manufacturing practices. Everything is completely sterile and, approved for use in humans. For the manufacturing of viral vector vaccines, like the Oxford and AstraZeneca vaccine, we grow these in mammalian cell culture. So we have these huge vats where we grow cells. The cells are able to produce copies of this viral vector, which has, the instructions for your cells to make the spike protein in it. And again, just like we would, order all of these components from synthetic, chemical companies and the cells, and we put them all together and make the vaccine. So at the end of it, they are purified to make sure there aren't any impurities in there, and then packaged into the vials for the vaccines.
That's amazing. Thank you so much, Dr. Anna. That's really good. One more question for you, though. So confirmation that research hasn't been rushed, and a lot of the news said that 1 in 8 in phase 3 trials succeeded. So it's unclear how we got 3 so quickly.
Yeah, so I'm not sure where the 1 in 8 statistic necessarily came from, but I can speak to what I do know. So I've heard this a lot too. And, of course, it's only natural to think that, if people hear that normally vaccines take 5 to 10 years to be developed and approved. So, why in this case were we able to do it in about 9 months, right? So it does seem a little bit fishy, but, I think we have to think about big picture as well. In our lifetimes, there's never been a situation where the scientists and clinicians and the funders and the regulators have all been focused on one single disease. So normally, even as a scientist, we're working on many different vaccines at a single time. And so, you're juggling all different things. It takes time to get funding that can sometimes take up to a year to get approved. And so when everybody is really working together and cooperating, we're able to make it happen in a much faster timeline. I think the specific thing about calling it rushed implies that we were able to cut some sort of corner. And this is absolutely not true. I can tell you from the science standpoint, we had to do all the normal trials. So there's 3 phases of clinical trials, phases 1, 2, and 3, which look specifically at the safety of the vaccine in the first phase, and the immunogenicity, or just how good of an immune response it generates in the second phase, and then the efficacy in the third phase. So they've gone through all the normal checkpoints that any other vaccine would have to go through.
Thank you so much, Dr. Blakely. That's wonderful, and that's quite insightful. Thank you so much. I'm just going to hand over. Just wondered if Dr. Razak Yasmin is available, because we've got a couple of questions for her. Yasmin.
Hello.
Well, one question actually, Yasmin. It's an interesting one actually. Do you think it is true that ethnic minorities are more vaccine hesitant? I am Black. My family and friends are happy to have the vaccine? Question mark. What is your view? And if some ethnic minorities are nervous, why do you think that is?
I think it's a really good question. And I think what you've said there is so important, that you are happy to have the vaccine. And I guess sometimes you put the not the story out, but we worry, don't we? And when we hear that one person doesn't want the vaccine, it may have a knock-on effect. Another person saying, well, oh, I must be careful too. If I'm from a similar background, is there something we don't know about? And I think it goes back to the whole thing about us needing to trust. And that's why I guess we have our scientists here to sort of explain things to us and make sure everything is safe. I'm ethnic minority, as you can probably see. I've definitely had my vaccine, and I've encouraged all of my family to have their vaccine as well. I think there's something else here as well about the self-fulfilling prophecy as well. So there is a lower uptake, unfortunately, in Black and ethnic minority groups across the country. It's not a London problem. It's definitely a problem, though, in the sense that we know that we are at higher risk of developing serious complications of COVID. At the same time, we have a lower uptake, and I think there's lots of reasons for that lower uptake. And one is the trust, and another one is, are we almost not using it, but are we becoming, with the negativity around it, are we becoming passive? And I think if you've had your vaccine and you know it's safe and you've had it and you're happy, I think it's about spreading the word and making sure that you ring up your neighbour, you ring up your friend, and you tell them your story, like you just told us your story, that you're happy to have it, your family are happy to have it, and just bring your family and friends down. But really having, as we are now, having those open, honest, frank conversations about those fears that we need to address and understand, so we can be confident in the decision when we do take, if we choose to take the vaccine.
Thank you so much, Dr. Razak, because that really makes, I resonate with that. And I've picked up from the community, there's a lot of leading members of the community that are BAME have now taken the vaccine. And there's been lots of conversations with the leading lights in the community, showing by example that they've taken it and it's safe to take. Thank you so much. I wondered if it's possible to get back to Pippa. Pippa, I wonder if you could unmute. Thank you, Dr. Razak. Thank you.
Sorry, I'm trying to type questions as well.
I hear you. Thank you so much.
I can't multitask.
I totally get it. So, a couple of questions here for you, Pippa. There is some confusion as to whether individuals will receive call-up from vaccination from their GP or a central NHS point. So, which is correct? What should an individual do if they receive a call-up from both?
So they will receive it by the GP. So wherever you had your first vaccine, they will contact you to have your second vaccine. So if you had your first vaccine in a GP service, they will contact you when the second vaccine is due. If you had it in a mass vaccination site, you'll receive a second letter to go and have your second vaccine there. So wherever you had your first vaccine, we've got every single patient tracked, and you would have your second vaccine in the same place, and they would all contact you. You don't have to contact them.
Excellent. That's wonderful. Another question. It's another two questions. A clearer idea of timetabling of the vaccination. Although I appreciate that this is difficult at the moment. Any ideas about the timetabling?
I'm going to be really honest. I have no idea. So I think it's fair to say we're working through as quickly as possible. We're currently focusing on groups 1 to 4, which is anybody over 70 or anyone that's clinically extremely vulnerable. And what we will do is ensure that the majority of that population is vaccinated before we go down to the next age cohort, which is then cohort 5 and 6. So I can't honestly give you a timetable, but we are doing it as quickly as we possibly can.
And that's quite evident. Thank you so much. And last question, how are you contacting people, especially those that are digitally disconnected?
Yeah, it's a really good question. So we have been telephoning them. So GPs have done a great job of telephoning people that haven't responded. So where they've sent letters out or where they've sent emails, if people haven't contacted them back, they have made phone calls. And I think it's fair to say, particularly for the over 80-year-olds, GPs or the practice have done all of that through phone calls, which is really helpful because it allows people to ask their questions or concerns before they come forward to be vaccinated. So it's proven to be a very successful way. So although it takes longer, I think we're committed to doing it in that way.
Thank you so much, Pippa. That's wonderful. Julian, I wonder if you can unmute. I've got a question here for you. Thank you, Pippa. That's amazing. Is it safe to have the vaccine if you're pregnant, trying to get pregnant, have an allergy, or immunosuppressed? I mean, it's a lot of questions there, but I wonder if you could give us some insight into that, Julian. Thank you.
Yeah, of course I will. I'll do my best to answer. And I'm chatting to someone on the chat as well about this, saying I was going to answer that question in a second. So let's start with the immunosuppressed, because that's a group that I know people are concerned about. The answer to this one is that we don't yet know how good the vaccine will be in those patients who can't usually develop an immune response, i.e. they've got suppression of their immune system. So first question is it safe to have the vaccine? Well, the answer to that is yes, definitely, because it's not a virus, not a live vaccine that we're giving, and some vaccines are live. These aren't live, so you can't catch COVID from this. So giving it to you when you're immunosuppressed is definitely not dangerous at all and could only be helpful. But what we don't know yet is whether you would generate as big a response and have as much immunity as somebody who didn't have the immunosuppression. Now, there are lots and lots of groups working. I know of at least 3 or 4 at Imperial, all on different patients who are immunosuppressed, such as transplant patients and things in the renal terms, and they will get that information out as soon as they can, but it does take a little bit of time. And that will be then to give people reassurance just how much immunity they do get from the vaccine, even having been immunosuppressed. The question about allergies is then another important one, and people remember the news reports when we first started using the Pfizer vaccine about severe anaphylaxis reactions, and there were lots and lots of concerns. While we've given more and more of the vaccine, the reality about the number of people who have these severe reactions has actually decreased. And so the concern about it has subsequently come down. And what it appears to be, it's not, originally we were unsure about why they were getting these anaphylactic reactions, and was it to do with foods and things like this. And it does appear to be one specific group of people who are allergic to some of the ingredients within the vaccine itself. So it's not wider than that. So that's why we ask you questions now about, have you had a reaction to a previous vaccine? And sometimes go through those with people who've had a previous reaction. So the reality is, for most people who have had anaphylaxis in the past or have had allergies in the past, it is completely safe to have this vaccine. And if you're concerned, talk to the vaccine centre or talk to your GP before you have it, but also come to the vaccine centre and have a chat to them, because they will know exactly what questions to ask and the ingredients and things like that. And then pregnancy and breastfeeding. So again, when the vaccine first came out, a lot of things were said, we've got to be very careful of this. And as more research comes available, more comes out. So breastfeeding originally was thought of, you shouldn't breastfeed, or if you're breastfeeding, you shouldn't have the vaccine. That's now changed, and the advice now is that you can have the vaccine when you're breastfeeding. The reality on the pregnancy question and people who are wanting to become pregnant is purely because we don't have the data. And that's the absolute truth. This is not a question of us thinking there is something that is going to go wrong. And there's no real reason to think that the vaccine will cause problems in the future of people trying to have children. It's not something which occurs with the vaccines. But the reality and the honest answer is we just don't have the data to reassure people in that way. So that's why there's a little bit of hesitancy around those areas. In terms of pregnancy, again, the actual advice is changing all the time. And what I would suggest you do is have a talk with your midwife, with your obstetrician, with your GP, and individually decide what is best for you based on the different risks, and they'll be able to run those through with you.
Thank you so much, Dr. Julian. That's really insightful. Thank you so much. I wonder if Dr. Anna Blakeney, could you unmute, please? It's just, we've got another question for you. Are you there, Anna?
Hi.
Excellent. Thank you so much. So what happens after the vaccinations? Am I immune? How long does the vaccine cover me? Do I need booster injections? And can I still pass on COVID to others?
Okay, so there's a lot of questions here. So I'll start to go through them, but I might need you to remind me of all of them as I go through. What happens when you get the vaccine? So, you get the vaccine. The point of any vaccine is that we're kind of trying to trick your immune system into thinking that you have an infection without actually exposing you to the virus. So as soon as your body sees that injection, you start to build an immune response. And, we start to see evidence of this immune response, which is, we call antibodies, about 2 weeks after the first vaccination. The term immune, I guess normally to a scientist implies that you're protected from the virus. We are still not sure yet whether the vaccines actually prevent transmission, but we do know is that they are very effective against preventing severe disease. So this is really promising. The reason for all of these vaccines and the reason why 2 doses are recommended is that by having the second shot, your immune response just continues to increase. And right now we don't have what's called a correlate of protection. And so this is just, fancy speak for basically something that we can measure in your blood that we know of a certain level of antibody that we know will protect you from the virus. So we don't know what this is for COVID-19 yet. We're continuing to study this and hopefully soon it will be identified. So our goal right now with vaccines is just to maximize your immune response. So Sharon, can you remind me the other parts of the question?
Yes, indeed. Thank you so much. So you spoke about the am I immune, and people are, the one part of your question is, can I still pass on COVID to others?
Yes. So we don't know for sure. So we're following people up from the clinical trials, and epidemiologists are, looking at this throughout the population. The reason we don't know is that the phase 3 clinical trials that have been done so far by Oxford and AstraZeneca and Moderna and Pfizer and BioNTech weren't designed to be able to answer whether you can transmit it or not. They were really designed to answer whether it prevents severe disease. And the reason for this is it's a lot harder and more expensive to do a phase 3 trial that looks at transmission. So this is being followed up, as people are getting these vaccines. So the honest answer is we don't know yet. So this is why there's still the regulations from the government after you get the vaccine that, you still need to wash your hands frequently, wear a mask, practice social distancing. You can't just be free into the wild once you get the vaccine.
Thank you so much, Dr. Anna. There is one more question. Let me just get back to that. I do apologize for the rustling of the paper.
No worries. Sorry, I'm just trying to keep it track in my head as well.
So the question is, after I've had both vaccines, how long will I be protected?
Oh, this is a great question. So another answer of we don't know for sure yet. So obviously, as these vaccines have, been trialed for about 10 months now, we can only really know how long it lasts for by following out people who have had the vaccine, and we've, been able to study them over time. So we're getting more and more information as time passes. The most recent results as far as the duration of immune response that I've seen came from Moderna. Moderna, which showed that 3 months after the second vaccination was the antibody levels were still really high. So, when we're making data-based conclusions, we can only say it lasts for 3 months. But if you look at the graph, it's like it goes up after the first vaccine, it continues to go up after the second vaccine, and then it basically flat lines out to that 3-month mark. So clearly it's most likely going to last for longer. We just don't know how long it's going to last for yet.
That's amazing. Thank you so much, Dr. Anna. Just before you go, I've just noticed in the chat room that Dr. Julian said there is emerging evidence is that the current vaccines do cover the new strains. So I guess that's good news, huh?
Yeah. So there was a study published by Moderna where basically how we test this is we can make the new virus and use that in the lab on our assays from people that have been vaccinated. We take samples of their blood and see how well their antibodies work against neutralizing and preventing the new strains of the virus from entering cells. And so that showed that, the old vaccines are still working on these currently new strains, but, really the benefit of having RNA vaccines is, as we saw last year, they're really easy to make new ones, which is, why they were really the first 2 vaccines that were approved. So in the case that there was, a strain that was, no longer worked for these old vaccines, we could just make a new version of the vaccines.
Wow, that's fantastic. Thank you so much, Dr. Blakeney. That's wonderful. I wonder, Pippa, are you still there? Can you unmute, please? We've got a question for you. Thank you.
Hi.
Thank you, Pippa. Quick question, and it's about literacy and language issues too. So what safeguards are there in the process of to support people, like language line for treble 1 calls or 111 calls? Thank you.
Yeah, no, great question, and we've put quite a lot of thought into this actually. So there are 2 things that we've done. So when you do the consent form and you ask the questions around the vaccine and you give people information about the vaccine, we've had that translated into our top 5 languages of where the clinic is. So we've looked at the top 5 languages of each clinic and we've had them translated into written versions. So when people are on site, they can read it in their own language. We've also got language lines. So all of these sites have got access to language line, and we've used that quite a few times actually for patients that have had additional questions to ask where English hasn't been their first language. So a combination of written, translated and language line is how we're dealing with any language barriers.
Thank you so much, Pippa. That's amazing. Thank you so much. Julian, I wonder if we can ask you another question, please. If you can unmute, thank you.
Yep.
Excellent. So the question is, Julian, how long does it take for the vaccine to take effect? And number 2, I've had COVID. Do I still need the vaccine?
Perfect, no worries at all. Okay, so the answer to how long it takes to become effective is around 10 to 14 days. So generally we would say 2 weeks after your vaccine. But it's also really important to remember that that doesn't mean that you can stop socially isolating, wearing masks and hand washing and all the other things that we need to do, because there is still, as I think Anna said, there is still the possibility and the probability that you can still pass on the virus. So it doesn't mean that, but what it does mean is that you will have the protection from that first dose of the virus to a very high degree, which is a good thing. But it takes 2 weeks to get that effect. The next question is about whether you've had COVID already, should you have the vaccine? And the answer to that one is yes as well. So there's no evidence that this would be dangerous at all, and there's lots of people who have had a vaccine. We recommend a break around 28 days from when you had COVID until you have the vaccine. And there's probably good evidence really that you probably get a good immune response if you've had COVID, and then having this first dose probably gives you another boost on your immune response anyway. And people often describe they get slightly more side effects, and it goes back to what we were talking about earlier, that sometimes side effects can be a good thing because it kind of shows you that the actual vaccine is beginning to work. And people have reported they get slightly more side effects with it. Nothing horrible, just the temperature and the sore arm, all the same things, but they're probably reported in more people. So that probably suggests that you are getting a good response to it. And the other thing about this is that we don't know, well, we know that the antibodies from having COVID last for about 3 to 4 months. That's what there's something called the Siren study demonstrated to us, and other studies which have been done in Southwest London and other places. And so it won't give you the long protection that we'd want with the vaccine, which is why it's important to also have the vaccine, even if you've had COVID.
Thank you ever so much. That was wonderful. Thank you, Julian. I just wondered, everybody, and feel free to put your comments in the chat room. Was there anything surprising from this evening? Is there anything that we've missed? You know, is there anybody else that would like to speak? Any comments about anything surprising that we learned today? I have learned quite a few things today myself personally. And is there anything missing, you know, in your opinion? You know, are there any details, information that's missing? I can see in the chat box people have put some questions. And just to let you know, to reassure you that the next steps would be, we'll have the event in about 3 weeks' time again. And I just wondered, because we've not really heard from Nafsika, put poor Nafsika on the spot. But is there any, oh, 3 participants has raised hands, right.
My question is that there has been a lot in the press lately coming out of Germany, but just a lot of noise about the different effectiveness of the different vaccines. And if Julian or somebody else can talk a bit about what you know about the effectiveness after the first dose and the second dose of the vaccines that are available to us in the UK.
And I'm wondering who'd be willing to take that question.
Julian.
Julian, you're a star.
I'll take that.
Thank you, Barbara.
No, thank you very, very much. So let's cover some of this. So the Pfizer vaccine is about probably around 89 to 90% effective after its first dose, okay, after 2 weeks, okay? So not from day 0, but 2 weeks after you've received it. The AstraZeneca vaccine is around 70 to 75% effective in that same time frame. So they're all really well effective vaccines. And people often ask, well, which one would you use? And it was funny because today I actually got asked by 2 different friends, both of them are doctors, separately, which vaccine they should use. And so I was asking for my opinion. And I ran through all the different parts to this about Pfizer and AstraZeneca and all the different parts. And one of them said, that's brilliant, Julian, I'm going to use the Pfizer. And then the other one went, that's brilliant, Julian, I'm going to use AstraZeneca. So the answer is that they are the same. And I would have the one that's offered, to be perfectly honest, because there's, I think they're both very effective vaccines to use. So I think that's the important part to that too. I think I've gone off topic, so I can't remember what the rest of the question was. Oh, sorry, no, I remember the other part to it. Was
That's right.
About Germany and Norway and things like this. So the German bit is really, I mean, how much this is politics and how much I don't know. But the short answer is that the trouble with the AstraZeneca vaccine is that the number of people in the older 55 age group was very, very small that it was studied on. But subsequent to that, there was a study done using the neutralizing antibodies on older populations, and it had a really good response to producing an immune response. So again, it is that the older people will get that older response, but the actual study that was done around using it didn't target the older population in the numbers that some people wanted.
Thank you so much, Julian. That's really complete. Thank you. That's appreciated. Just to say that we've come to the end and to thank you all so much. I just realized I should have done a quick poll. I wonder if people could just bear just 30 seconds to do a poll and to do the third poll, because we really like to garner your opinion about how likely, following this event, how likely are you now to take the COVID-19 vaccine? Thank you so much to those that have filled in the poll. And it seems as if there's a sort of even spread with, I guess, highly unlikely. How likely are you to go now and take the vaccine? Thank you so much. Let me just share this result for you. Thank you so much. I'd also like to say a huge thank you to everybody, all the speakers, for you and for people that have attended. Thank you so much because there's a range of people on this platform here. Thank you so much. We'd also like to say thank you to Healthwatch Central West London. And yeah, and the next steps, it has been covered by Julian earlier, but we will be having more of these events. I'd very much like to say thank you, stay well, and good night.